takeaways this morning, Dr. Lombard, with the stealth variant, Omicron. So that's what happened with this surge. I remember he had come on and said that because we got through a bad Delta surge, that he was saying, oh, maybe this Omicron wouldn't last as long, and he ended up scratching his head. Why is this lasting so long? And then we got the results from the JIC that said, hey, boom, you guys got the Omicron stealth variant. That's why. And so, Dr. Hoa Nguyen, this is, just thinking back at the beginning of the surge, you were calling for the restrictions. It never happened. And now here we are in this, going on almost 2 months of this stuff. What a way to ring in 2022. Not exactly how I thought it was going to go. Good morning, Doc.
Good morning. It is what it is, right?
Oh, God, no. No, let's not. I don't want to start there. I don't want to. It sure is what it is. Doc, and I know you had a couple of things you wanted to get out to the audience. Can we first start with the home test kits? Everybody and their Nino has a home test kit. And I know of people who are just testing at home, maybe popping positive and just kind of doing their own thing, right? So can you just run us through what is the protocol and what should you do and how should you use these home test kits that a lot of people have now?
Okay, so as per Dr. Lombard presentation this morning, so a lot of people are having home test kit now. Either they buy them or the federal send you, I think, 4 kits per family. And it's an excellent thing to have at home, but people need to know how to use it and what is it for. Okay, so number one is every test kit have two tests in it. Okay, so it's not for 2 people. It's for 1. Okay, so let's say that you have symptom and you test yourself the first time and it's negative. Doesn't mean that you don't have the virus. You really have to kind of wash yourself, wear your mask around other people if you have symptom, and then repeat the test for about 3 to 4 days. Okay, so probably about 3 days, but that's what they want you to do, because you have to have 2 tests. So test negative first time does not mean that you don't have the virus. Okay, we see quite a bit of people that test negative in the clinic, and we always bring them back if they're symptomatic about 3-4 days and retest them. And the overwhelming majority will test positive on the second test. And that's why every test kit have 2. It's not for 2 people. It's for 1 person that need to be tested sequentially within 3 days or so. So please do that. We have a lot of people that call in and ask as our patient to say, hey, I test positive at home, so what do I do? So, so we tell them what they need to do to isolate themselves for the next 5-6 days. So this is where the JIC report a lower number positive at this point. And yesterday it's really good, it's about 33%. But there's a lot of them that test positive at home. So I would, I don't know how we're going to count those people. I don't think that there's a public health line that people can call in for to report they're positive. I'm really not sure what the use of it for them to report anyway. So, but the number is still out there. So people still have to practice 3W. And if you test positive at home, please, stay at home for the next 5 days. Okay, and isolate yourself against your family and do not go to work. But that's the tricky part, is that how can you call your workplace and say I test positive without the official result from a clinic or a testing site? So it's another problem that I think that somehow public health has to put a guideline together in order to guide the employer how to treat the employee as they call in to say, hey, I'm positive by doing the test at home. So that's a challenge by itself. So
you're right, yeah. I mean, Doc, you're right. There should be a number. If you have a home test and you tested positive, call, 333 test or whatever. But you know what? I know public health right now is probably thinking, oh, this surge is going to be over. What's the use?
Yeah, so I have a gentleman yesterday that tested positive at home. He's symptomatic 5-6 days ago, and he had to do a PCR to go to Philippines, and his PCR popped positive, right? So he kind of messed himself up because now the the isolation to travel start the day you turn positive with the PCR, so not with the home test kit. So he had to wait another 10 days before he can get into the plane. So that's something that is not a lot of thought put out there before they send out the test kit at home and what to do with the test kit.
Doc, we also chatted a little bit this morning about the accessibility for the monoclonal antibody treatments. There's about 4 different ones that public health is offering, and each of them come with a certain set of conditions, right? So this, monoclonal antibody treatment 1 is for people with this, and 2 is for this. But we were talking about the accessibility of these treatments, because each one of these 4 monoclonal antibody treatments that we have available through public health require a referral from a primary care physician. Is that an issue? And then also I wanted to ask, how are we doing with reaching the homebound patients with these monoclonal antibody treatment options?
So, there's 4 of them out there. One of them is through the IV infusion with sotrovimab, and the other one is oral agent for 5 days. The sotrovimab probably the safest one of them all. The Paxlovid is an excellent oral agent, but again, there's a lot of side effect with the Paxlovid, and also there's a lot of things that the high-risk patient, unfortunately, if they're on certain medication, it's a contraindication of using a Paxlovid, and also they have to watch for the kidney and the liver problem, which a lot of our high-risk patients have. So the Paxlovid is very good, but you do need to see a physician to make sure that you are a candidate to take the Paxlovid. This is an oral agent, it's free. There's multiple pharmacies that carry them. The sotrovimab is an infusion, just like Regenco. I think you shouldn't need to have a physician referral to go get the sotrovimab, just like Regenco. If you test positive, and we see quite a few people that test positive that at the pharmacy, at the fairground, that really are high risk, but nobody referred them to sotrovimab infusion. Just that way they cut down the risk of being in the hospital. So I think that should be just like Regenco. The public should know if they test positive and you have any comorbidity like high blood pressure, diabetes, cholesterol, kidney problem, asthma, smoking, they should go to the senior center and present themselves there and ask to see if they can have an infusion. I know that there's kind of mixture problem that they have to mix somewhere else and bring it to the senior center. But I think they should do something to improve that process. But it should not require to have a physician referral to go there to get the infusion, because a lot of people test positive, like I say, it's hard to get a hold of the physician, or they don't have a physician to get a referral to. So I should be open to the public and educate the public, and hey, we have this infusion, go get it if you have comorbidity.
Thank you so much, Doc. Have a great weekend. Be safe, right? I feel like I want to ask you for your parting message, but I already know what you're going to say. Practice the 3 W's, right?
Yes, sir.
Gotcha.
And be safe, and wear your mask, and if you don't have to go to gathering, don't go to gathering. We are still bracing for the Super Bowl gathering and see what happens this week.
Thank you, Doc.
Be safe, guys.
You too. Dr. Hoa Nguyen of AMC Clinic Family, and also the former Physicians Advisory Group chairman. It's 8:49. Let's get into SportsLink. SportsLink, guys, is brought to you by Marianas Irrigation and Landscape, and it's presented by our very own Dave Delgado, the hardest working man in sports business. Marianas Irrigation and Landscape, your Shindawa and Echo superstore, offering everyday low prices on bush cutters, chainsaws, power washers, generators, and